Hello there. Thank you for joining us today for our discussion on senior living trends and challenges in 2024 and beyond. I'm Jennifer Schwalm, partner in our Senior Services Group at Baker Tilly. Our Senior Services Group and our team is honored to be a business advisor to hundreds of senior service clients throughout the country. Our team brings a provider-based experience and tenure in aging services to provide practical solutions in our unique aging services environment. Joining me today is Ed Click, partner and Beverly Asper and Mike Edwin, both directors in our practice. A few housekeeping items. Please be sure to include your name with any questions in the Q&A section so we can respond directly to you if we run out of time today. Also, please watch your email for invitations to our annual executive roundtable discussions, which we're planning for in March. So getting started today with our presentation. While our aging services continues to encounter new and ebbing headwinds, we're seeing some positive outlook related to the rebounding occupancy levels in independent living and assisted living and personal care. Certain parts of the country are seeing a rebounding in staff retention, resulting in lowering agency costs. Additionally, over the past year, most states saw a substantial one-time increase in Medicaid rates for those with nursing services. The relief of inflationary pressures unfortunately resulted in higher capital costs by way of increased interest rates. But we will continue to celebrate the small wins as aging service providers continue to remain committed to the quality care and services for our elders. Today, my colleagues and I will discuss our thoughts and opportunities for responding to certain trends around reimbursement. Also, the drive for a sustainable business model, considering right sizing of services, growth, and affiliation, looking at opportunities for non-traditional services, and our perspective on the impact of changing consumer preferences. We recognize that the wage and staffing pressures will continue for the near future. The importance of that, which when combined with the proposed federal staffing mandate in the nursing setting, cannot be dismissed. However, for purposes of our presentation today, we acknowledge the influence of continuing trends such as staffing pressures and the interest rate environment, but will instead focus our presentation on those items that can be influenced to overcome these headwinds. So for this, let's get started with what I would say, let's start at the very beginning, right? All of these considerations are influenced by the reality and practice of our governance model in our organizations. Before I turn the presentation over to Beverly Asper, let's start with our first polling question. Please note that in the interest of time, we will be sharing polling results at the end of the presentation or as a follow-up to this web. So for our first question, what are the current challenges regarding governance? And you'll see your answers there if you have the opportunity to choose two. And with that, I'll introduce Beverly Asper to talk about the reality of the governance model.
Thank you, Jennifer, and it's a pleasure to be with all of you today. Governance is an area that is so essential for the nonprofit. And one of the things that I'd like to highlight today are just some of the trends in governance for senior living specifically that we see when we're out working with clients across the country, as well as trends that even are applicable outside of the senior living environment. So let's start with the refocus on strategic development and execution. This is an area that is essential for nonprofits to continuously be engaging and working on strategic development for the organization. With all of the challenges that have happened in the past, I think some organizations maybe have put this off to the side as something they'll do in the future, but we would encourage you as a trend here for 2024 that you really take some time as an organization to focus on the strategic direction and executing the strategy that you develop. You can do that and encourage those conversations by creating perhaps a consent agenda where you're not spending the whole board meeting talking about the reports of each department, but that you're allowing and creating time on that agenda for real conversation around the organization's direction and its future. Another trend that we are seeing and that we would encourage you to consider for your organizations is really revisiting your board complement. Everything from the tenure of the board members to their talent, even to the diversity of the board. And that is something that, we're all focusing on, all organizations are focusing on diversity. And this really starts at the board level of all of our organizations. So that's something that we're seeing is just a real revisiting of the board, the talent of the board and the diversity of the board. Another thing would be a focus on organizational stability. And with all of the challenges that we've been through, we're still using the word VUCA environment, which is the volatility, uncertainty, complexity, ambiguity. The term is VUCA. And we're really seeing that organizations need to focus on stabilizing now. And for board members, this might mean understanding the financial position differently than before. It may require actual training of board members to clearly understand the financials and the indicators around success and stress. So defining what is a stable organization, setting those goals and metrics that need to be in place, having a process to monitor them is essential. And then even just understanding what are some of the early warning signs that board members should be looking for so that you don't find yourself so far down the road in turmoil that you can really, make adjustments as necessary before things get out of control for the organization. Another area that we've seen a little bit of traction in is prioritizing the relationships with all of the stakeholders. So instead of board members being somewhat detached from the organization, it's reattaching, creating those relationships with not only the senior leadership team of the organization, but really focusing on resident relations and donor relations as board members, as a collective group of board members. And that kind of stems into another area that there's a lot of writing around this idea of the impact of the board on the local community. So the board's willingness to participate in the community by promoting the brand of the organization that they represent, and also educating the community at large on the mission and the services of that organization. Those are primary responsibilities of board members. And we're seeing a little bit of traction in this area where boards are starting to look outside of their organization and say, how can we leverage within the community? How can we better serve the community that we're located in? So that's something I wanted to point out. Also, diversifying program revenue is essential. And we really encourage you to be looking at ways that you can identify non-traditional services and even the possibility of entering into a new marketplace. So those are really more on that strategic thinking, but something that we wanted to just point out as a trend and as an opportunity for you as senior leadership team members, as you're working through agendas with your board chair, to really be thinking about how can we focus off, our eyes must stay focused on our current business, but are there other ancillary businesses or non-traditional services that we could be also exploring that make sense within our organization and within our community. Also, just to touch on openness to collaboration. This is something that we're definitely seeing a trend. Many boards have been so close to their own organization, but now we're seeing a real movement toward focusing on collaborative initiatives with other organizations. So something just to be thinking about, whether it would be a non-senior living organization in your community or even a senior living provider for collaborative purposes. And then last, I'd like to just speak to refocusing on the mission. So a lot of times we're reactive and responsive to our environment that we're in and some of the government regulations and that type of thing. But really taking a look at the mission of the organization, the board's responsibility is to ensure that all of the organization's resources are effectively deployed. And I think that's the word I'd like to leave with you, is effectively deployed resources, so that the mission is being furthered And if there are things that are going on that are outside of the mission, to really pull the reins back and to refocus on just what's missional for your organization. Okay, and I'm going to turn it over to my colleague, Ed Click, to cover some key trends around reimbursement.
Thanks, Bev. So maybe going back to Jen's initial observation about what's happening in the industry, two things impacting the skilled nursing setting that we're not going to get into that continue is census and workforce. So we're not going to get into those. Where we're going to focus our time today is on some reimbursement opportunities and trends that we've been working with a number of providers on over the past couple of years, and trying to assist providers with stabilizing that skilled nursing division within CCRCs as government funding has begun to subside and challenges from an operational perspective continue. So starting at the federal level on a Medicare side, so Medicare fee for service, federal fiscal year 10/1 of 23, which is for fiscal year 24. We did witness an increase of approximately 4% net increase, which is up around 1.3% from the previous year. So that was positive. There were some changes in ICD-10 codes, as well as the QR, the quality reporting program, and the value-based purchasing. I'm not going to get into those details. And also with that, there were, I'll say the biggest wild card was the minimum staffing requirements. They did put out proposed regulations and rules in September. Comment period ended in early November. And the three areas that they really focused on there was the enhanced facility assessment, RN on-site coverage 24 hours a day, as well as the minimum staffing. And really, there was a lot of pushback from the industry associations in really looking at those levels, and was really silent to the LPN. So we're curious to see some of the outcomes and output with CMS taking into consideration all the feedback from the providers, and see where that will take us to, and how that will impact us all financially, as some of those could be implemented in the next 1, 3 to 5 years. Continuing on that, as everyone I'm sure is aware, with the transition to PDPM October of 2019, it was set to be budget neutral, but there was a 5%, roughly 5% increase. So over the past year, beginning in June, CMS has started performing claim audits, which is in the hands of the different MACs. It's called Skilled Nursing Facility Probe and Educate process, where every facility is going to have 5 claims looked at. So some states, I know that this was issued and looked at, some have not yet. So I would be prepared to respond to those follow-up in relation to the claim audits that, if you haven't received, you'll probably be receiving here in the near future. So shifting gears from Medicare fee-for-service to Medicare Managed Care Advantage, we're seeing an increase. So some trending areas from that perspective is it's impacting everyone across the country, but it varies from state to state. So once again, some states impacted more greatly than others, but rapidly increasing, higher enrollment in the managed care area, as opposed to, we're seeing some decline in the Medicare fee-for-service. So why does that become an issue from a reimbursement perspective? So as that increases, really what we're seeing is the financial impact. And on average, Medicare Advantage is $150 less per day. So decline in reimbursement when we're seeing that trending. So that's negative from a operational perspective. Lower average length of stays we're seeing with Medicare Advantage. More administrative requirements. So they give the HCPCS or the code prior to the payment being set, so that they're set on certain levels and areas where they're going to pay. We're starting to see more and more audit volume. So for all the claims that you're submitting, they're auditing a lot of those claims. So it's I'll say administrative burden, and there are takebacks if there's not supporting documentation of the service that's currently being delivered. So we're seeing an uptick in that, which is creating some challenges for a number of our providers. Also, from a state perspective, we're starting to see more transition from the RUG-based reimbursement systems to PDPM-based reimbursement systems. So these transitions are set to occur by the end of 2025, as CMS stated that they'll no longer be supporting the RUG system. So from a clinical perspective, we're seeing a lot of changes there and a lot of shift with state reimbursement to a PDPM driven model as opposed to a RUG based model. So in these PDPM models, we're seeing the nursing component of the PDPM rate, or a combination of nursing and non-therapy ancillary component being utilized is that driver. And a majority of the states are utilizing quality measure reimbursement incentives that tie directly to the CMS 5-star related quality measure. So tying quality to reimbursement, we're seeing more of at the state and federal levels. So reimbursement opportunities and trends, what I would suggest is continue to utilize benchmarking information, compare apples to apples. The minimum data set, the MDS, is really the key driver of reimbursement from the federal and state level. So that RNAC department is continues to be critical, and there's going to be changes in those areas. So if you're a standalone, it's the re-education, the training, and validating some of the new systems or changes that's going to be occurring at state and federal levels. One opportunity I'll say that we've worked with a lot of providers on is really just evaluating your Medicare rate, fee for service, or your PDPM rate. Compare that to your wage index, your CBSA, and see what your rate is compared to your peers. Sometimes that's eye-opening. So we do have benchmarking of all cost report data that we can see that and share some of those thoughts with you as well. Then lastly, where we've seen some opportunity from a reimbursement perspective is continue to analyze the accounts receivable within organization. We're seeing transition, turnover in staff. There's different billing requirements with Medicare Advantage. Some of them are timely as 60, 90, 120 days. So a lot of lost revenue from that perspective if the billing's not occurring. So really take a look at your accounts receivable, your allowance, look at the MA pending process, and really focus on just making sure that you don't have a significant bad debt expense when you compare that to your net patient service revenue. So those focus areas have been some wins to help our, I'll say, skilled nursing components within CCRCs or even standalone skilled nursing stabilize that operational perspective. So opportunities exist. So now I'm going to turn it over to Mike to talk about creating sustainable business models. So Mike, floor is yours.
Great, thank you, Ed. So good morning, everybody, or good afternoon, depending on where you are. I happen to be outside Chicago, so it's Central Time Zone where I'm at. So I'm going to talk about some key trends around creating sustainable business models. And then my colleague Bev will be talking about a couple of things as well. First, we're going to talk a little bit about healthcare right sizing. We believe that right sizing will continue in 2024, although there is a trend of right sizing nursing homes and eliminating underutilized capacity and empty beds, especially in the nursing home. Evaluation of capacity needs in your area is a good first step before you start downsizing or eliminating empty beds that you're no longer using or unable to staff. Take an honest look at your situation before you decide to eliminate beds or convert those beds to alternative use, which I'll talk about here in a moment as well. Because your area may very well need those beds, and there may be other reasons why they're vacant. So taking an honest look at your empty beds first before you just decide to take them offline, but certainly not holding on to beds with the hope that they may be full down the road is a good strategy. Hope is not a good strategy in general. So within the realm of right sizing, let's focus on a few key areas. First, let's talk about right sizing the nursing home. In 2024, we will continue to see downsizing and right sizing of skilled facility beds in most markets, as I said, and depending on the capacity in your area. Right sizing may have already occurred in your area through attrition, closures, and consolidation. And this has created potentially some challenges for your organization because you might be in a region that has too few beds to meet the needs of the potential demand for long-term care referrals from hospitals and other sources. However, you may not want to take the demand that's out there for various reasons. So although there may be demand or need for the nursing home beds, it doesn't necessarily mean you should keep them open. Financial, staffing, and regulatory pressures will continue to drive organizations to evaluate whether to keep the current capacity in the nursing homes and or exit the service line altogether, which we are certainly seeing has been a trend And we think that that trend will continue in the next 12 months or foreseeable future. You could evaluate or should evaluate whether you should decrease the number of skilled beds for several other reasons. We know that reimbursement is still not keeping up with the costs of care in many states, and we don't see that changing for the most part. Some states, like Wisconsin, if you happen to be from there, have recently completed methodology revisions that has resulted in an increase in Medicaid reimbursement for many long-term care providers for nursing homes. In some cases, this has significantly reduced the financial burden and strain on nursing homes related to Medicaid losses. However, in most other states, your Medicaid does not cover the cost of care. We don't see that changing in the near future. And especially as acuity levels and patient complexity of residents increases, which is also a continuing trend this next year. If you are in this situation, you should definitely evaluate declining the nursing home bed capacity to a level of sustainability that's balancing the Medicaid reimbursement, cost of care, and other revenues that you're bringing in through alternative sources. Staffing shortages, as we said before, and everyone knows, will continue to be a driver, although maybe it's been relieved to some extent more recently. But do you really believe that you'll be able to staff the empty beds that you have? If you have a unit or two or three that are offline and have been for the last 3 years, do you see that changing in the foreseeable future? Staffing trends in 2024 might well be your single biggest driver for considering whether to decline or eliminate nursing home and healthcare capacity altogether. The resident population that will be referred to skilled nursing will continue to be higher acuity, higher cost, potentially lower profitability, and or create losses in the skilled nursing bed environment. We think that this trend will continue in 2024. There are no indications that the referrals coming out of the hospitals will have declining acuity, declining age groups, and so forth. So the resident population that you've experienced these past year or two may very well continue to be your highest percentage of referrals coming out of hospitals going forward. And of course, it can't be unsaid that consumer preferences for alternative to nursing homes will continue in 2024. Those can include home health services, assisted living, memory care facilities, bypassing the nursing home altogether if they can, remaining at home for as long as possible. Consumer preferences continues to drive the decline in the usage and therefore a vacancy of beds in nursing homes, and is probably next to staffing shortages the single biggest trend that will impact you in the next 12 months or longer as you go forward. We've also seen and continue to see providers finding open space this year and assessing utilization of how to use that, going through a utilization assessment of how to fill that vacant space for revenue generating programs and services. That could include assisted living. It could include other alternative sources as well, or services as well. One important thing to consider while you're evaluating converting units in the nursing home to alternative uses is the financial feasibility of utilizing that open space for that particular revenue stream or program. Converting that empty space or utilizing it will potentially require capital, potentially to require other changes to the physical structure, to convert to the license type that you're looking at, if it's assisted living, or even an unlicensed program that you might be considering. And the staffing model needs to be evaluated. It's not always possible to generate revenue from a vacant space. So going through a thoughtful and purposeful process of evaluating conversion of empty space to some other program or service use is a prudent and suggested course of action this next year. We will see providers finding alternative uses of vacant space outside of healthcare or assisted living or memory care as well, thinking through creative partnerships and potentially affiliations to find alternative revenue and uses of those spaces. It doesn't always have to be a light program, in other words, that could be used in those spaces. Higher acuity is a trend that will be seen in assisted living. And this is impacting and driving the need for assisted living beds and potentially creating vacancy as well. As more and more residents are admitted directly from home as they've aged in place and have higher acuity needs or hospital to assisted living, diverted from the nursing home setting, higher acuity will continue to be the norm. Although this is not a new trend in most states, this will continue in 2024. Residents will continue to wait longer to move from their home and will be higher acuity at the time of that move. This will likely increase the cost of care, and you should evaluate your pricing model closely, whether it's in a converted space that you have recently gone through, or even in your existing assisted living. Although we've seen anywhere from 8% or higher potentially inflation of prices annually the past few years due to the higher cost of labor and other operational factors. We also feel you should consider evaluating your cost of care due to higher acuity if you haven't gone through that particular exercise. As you look forward to utilization of space, you might need to inflate your prices even higher than you realize to make the assisted living a profitable endeavor. Higher acuity will also put the pressure on management for increased training for staff to handle the resident level of care needs as they come into your facilities. And finally, higher acuity residents in your assisted living settings will create situations where you might be pushing the envelope on regulations and levels of care that are allowed by your state. Some states allow a lot of care in assisted living, some states do not. Some might limit direct care, and some may have unlimited personal care, for instance. And because of consistently higher and higher acuity of residents will put you in a position that you might have to turn residents away or discharge sooner than you would like. We also see a trend going forward for increased focus on memory care. The 85 and over population is still that population segment that is growing the fastest in many areas of the US. Although that 75 to 84 segment is starting to catch up, the 85 and over population will continue to increase faster for at least the next few years than the other age segments. This will increase the need potentially for memory care services at your community and in your area, whether a dedicated memory care assisted living unit or a memory care unit in the nursing home or some other type of memory care program that maybe you hadn't thought about before. And this, of course, could be done in a vacant space of your nursing home or some other vacated space that you're no longer using. Although the pandemic did suppress development in the past few years, keep in mind that the trend has been the norm, a higher need for memory care for quite a while. And in your area, there might very well be plenty of development of assisted living, creating some saturation of capacity. So it's important for you to do your market studies and look at your competitors and whether there truly is a need for a memory care program. However, ensuring you have a proper memory care program for your residents of your community is still relevant in the next year, and whether you should be creating additional capacity specifically to your specific to the memory care population in your specific area should be evaluated fully, as well as doing some financial analysis around utilizing existing space for that type of program. One last thing I'll mention is that we are now finally seeing increasing in the younger senior populations, 75 to 84. For many years, that population segment of in our country was not growing very significantly, and in many cases, it was declining due to that 80 to 85 segment. And we're now seeing that tide start to turn, and certainly by the next few years, it will be turned even more. And as a result, we're starting to see a much higher increase in development of independent living options. Now, whether you can utilize existing space as you have closed down healthcare beds is yet to be determined. Independent living units don't often easily go into an old or existing nursing home setting. However, we do believe over the next year and beyond, we will see an increased interest in independent living from that age segment. And this is a lower labor, lower cost service delivery option, and profitability in this option is greater opportunity for you and a good investment for financial stability of your campus in the long run. Again, the pandemic depressed development and interest in this area, including interest rates, inflation, higher cost of construction, and these developments are sometimes difficult to pencil out. However, 2024 should see a resurgence of development and independent living due to increased demand and interest of this younger senior living segment. Beverly, my colleague, will likely touch on independent living a little bit further as well. But before I turn this over to her, I believe we have a polling question. What are the key factors your organization has considered in right-sizing your healthcare delivery model? And as you consider the options A through J on the lower portion of your slide, please choose the top two. Thank you for that, and I will, at this point, turn it over to you, Bev.
Thank you, Mike. Hi, everyone. This is Bev again. I do want to touch on some independent living trends. Thanks for teeing that up, Mike. At this point, I wanted to just cover a couple of things. As Mike mentioned, the low staffing need of independent living is one driver for this trend, but also if you think about how less and less folks are, actively moving through a continuum of care and choosing to stay in place or live in place, this really drives the desire for organizations to have additional residential living options for their clientele. So one of the things that we're in our development area that we work in as well with our clients, we're really seeing this trend toward maximizing land use, which, of course makes logical sense, but really considering land extremely precious. And so how can we develop desirable, marketable units on our land to the best capacity, or the maximum capacity? Ways of looking at that could be the pocket neighborhood style home, which often attaches more than just two units together. Hybrid units, which we all know have their financial challenges in developing, but they're lovely when those are available. And that's one way of consolidating and bringing the unit count, making the unit count higher than just doing, let's say, the traditional duplex. Looking at clustering smaller apartment buildings, so almost like the hybrid unit plus, and could we put an additional floor on, those types of things. And creating space conscious living environments. In other words, bringing down some of the square footage of these units. There was a time where a lot of our independent living units were up over 2,000 square feet. So how do we create those desirable and conscientious living environments in smaller spaces within the unit itself? The open floor plan, bringing the outside in, all of those concepts are on the table for the trends that are out there today, and where we would encourage you to be thinking as an organization. When it comes to active adult, again, some organizations have their own active adult product or some type of residential living that mimics or mirrors active adult. Others are trying to develop their own offsite active adult community. And then others are partnering with existing active adult, really depending on the market that you're in. Some are even oversaturated with this product. But really looking at this as, how do you extend your current services into these environments? It's a captured audience of residents who live in these homes even longer than they did 10 years ago. So we're really looking at maximizing residential living, maximizing land use, looking at active adult as an opportunity to extend services versus a competitor, and even as an opportunity to diversify your own product type by having a community that mirrors an active adult. Even if it has an entrance fee, it still could mirror some of the more competitive active adult communities that might be in your market. And then last, I just want to touch very briefly on the middle market housing. So this is still a missional focus. We see that trend continuing for our organizations. It's difficult to do this, and to do this with a margin, right? So really breaking this down into what we consider low middle, the middle, and the higher middle market ranges. And then developing, first of all, which of those areas should your organization target if this is part of your mission approach? And then second, what is the housing type that actually corresponds with each of those segments of the middle market. So low, middle, middle, and higher middle. And this is really being strategic about the development of middle market. There are different product types that go along with each of those segments. And there are different pricing structures that go along with those different segments. And each of those needs to be very clearly identified and then evaluated for success. So I just wanted to point that out, that middle market doesn't have to be a big confusing factor out there. There are ways to break it down, to match it to your mission, and then to develop a product and a pricing structure that makes sense within whichever one of those target categories that your organization resonates with. I also just want to touch very briefly on affiliations and consolidation. So this is a topic you're hearing everywhere. We know that every conference, every webinar, everything touches on this idea of affiliation and consolidation. And we are seeing just exponential consolidation within senior living. I want to just go outside of senior living for a moment to say that this is a natural phenomenon that occurs in the nonprofit space. Nonprofit organizations outside of senior living are also rapidly consolidating. And I like to look at that as an opportunity to do more good together. And this is normal and natural and part of the nonprofit life cycle for organizations to come together and to be stronger and to just have more coverage, more mission impact, and more, market relevance together. So be thinking about affiliation and consolidation from maybe a different lens as we move into 2024. Are you an organization that should be pursuing affiliation and consolidation with organizations that aren't as strong? Opening up to what does it mean to affiliate? How would that affect us and impact us? And also on the smaller organization side, opening up to this idea of what kind of partner would we look for if we were even going to consider going into an affiliation with someone. So it's really that whole idea of setting your criteria, having those conversations early, making sure the board is fully educated and aware of what it means to come together with another organization to do more good together. And that doesn't have to be a formal merger. That can be in the form of something more programmatic, like a programmatic joint venture, where you're coming together around a centralized program and, rolling out something to your marketplace together. So there are different ways of looking at affiliations and consolidations, joint ventures and partnerships that really should be in alignment with the mission of the organization. So that's just an area I wanted to touch on. I did not want to dive too deeply into that because there's so much involved in evaluating readiness of the organization, criteria for what types of organizations could work well together. And also these are very marketplace specific alignments that occur. So I will, I think at this time, I'm turning it back over to you, Jen, for non-traditional services. Okay.
Thanks, Beth. I think we have a poll first.
Yeah. Okay.
So you have a poll. Which of the following would reflect your organization's approach to growth and/or affiliation? And you can see items there A through G. And while you're responding to that, I will move on to talk a little bit about non-traditional services, exploring non-traditional services. And I've started off by saying, and I think Mike alluded to this as he talked about the right sizing of healthcare services. We've seen what I would call a blurring of the lines of service delivery. And I've found over the years that we have sometimes let the regulatory boundaries drive our decisions around our business models. And today's environment, I think, has created opportunity for us to think a little bit different about how we approach our models. And, we've seen some of this happen over the years when you look at the role subacute units or transitional care units have played either in the hospital or in our nursing homes. Some other examples of that includes, as we saw the expansion of assisted living and personal care to accommodate services that used to only be provided in the nursing home. That was the long-term stay. So there's, a number of examples as our world has continued to evolve in that healthcare delivery model. We know that traditional or reinvestment in traditional care models has not always been the best solution for that business model, as a number of our providers are looking at what that future looks like. We also, I think, have been exposed and been observing a number of providers with some creative examples of what I would call non-traditional services to meet the needs within the local environment. So one example was a nursing facility that had sections of their building closed, and they were responding to a health system's need for intermediate or long-term placement of behavioral health patients as an alternative to actually closing the entire building and no longer being able to offer services. That particular provider was successful in leveraging segregated wings with respect to the programming options to safely accommodate the mix of patients in the building while sustaining their commitment to nursing services. We know that that is not an environment or a situation that may appeal to everyone, but I do believe there are certain circumstances where being able to meet that need is an option that can seriously be considered. We had another example of a provider that was closing a nursing wing due to staffing constraints, but they were able to effectively, at the time they made the adjustments, they were not able to effectively adjust the dining staff for the decrease in the number of residents. As you know, there's a level of staff that's needed to offer our services regardless of the number of residents we may have. And that particular provider instead became licensed to provide Meals on Wheels out of their dining program, effectively leveraging their staff while creating a new revenue stream for their operation, allowing them to continue to serve those in their area. Many of the things we touched on today, including the general rise of healthcare costs, greater acceptance of cost-sharing arrangements, the focus on quality measures and outcomes, and also the consumer's control of their healthcare journey, are triggers for solutions that are now focused on long-term health outcomes and prevention. While many of our life plan communities have been managing the long-term health of their residents within that continuum of service for many years, the rest of the healthcare ecosystem is now transitioning to shared service programs, also called value-based care arrangements. So this has created the opportunity, I would suggest, for our aging service providers to intersect at either new or different points within that entire healthcare ecosystem. So some examples, we've seen providers that have already taken advantage of participate I-SNP programs or IE-SNP programs that are being driven by primarily by health plans and health systems, depending on where you are in the country. There are also a number of provider-based programs that are formed or forming with opportunities for upside and downside risk, depending on the provider's interest and the strength of their outcomes. Personally, I have always been a strong proponent for the value that our providers bring to the larger ecosystem, and understanding that our services as senior service providers extend far beyond that of just meeting the care needs to include a robust lifestyle and a multi-dimension wellness programming. So I think that this is a great opportunity for our aging services environment to be taking a stronger position on capturing the value of those programs and intersecting appropriately. In support of the long-term health management, we're seeing life plan communities invest in formalized care navigation strategies under either a social worker model or a clinical model to ensure that its residents are receiving the right care at the right time and at the right place. Again, this is a concept that many of our providers, especially in the CCRC setting or life plan community setting, have been embracing for years, but might not have formalized in order to market as a differentiator or to create it as a revenue source. So the structure of this program, though, it's critical as we're watching. It's critical that the structure of this program understands and is deliberately planned to balance that reliance on entrance fee cash turnover with the residents' desire to age in place in either their cottage or their apartment. So a lot of decisions that have to be considered or impacts that have to be considered in that model. We're also seeing a rise in niche services in partnership with local health systems, as well as integrated services with physicians, in which we're seeing in some cases providers are either partnering with physician groups or the health systems, or they in some cases are developing their own or acquiring physician practices as a potential for a revenue stream. In certain states, physician partner groups recognize that they can be leveraged differently than that traditional role that we have seen in the past. And in some cases where we've seen them partner with life plan communities, they've been able to actually provide additional caregiver support to backfill shortages in a campus-based setting, therefore making it beneficial to both parties and also the residents. With the growing acceptance of palliative care programs, licensed social worker services are now being billed more often to support the underlying business model of that palliative care program. In each of these examples, a senior services provider might formally or informally partner with a physician group to take advantage of all the services that could be billed or are billable under that respective scope of service. And in this case, there's opportunity to leverage that partnership on behalf of the either life plan community or the aging service provider, to generate the additional revenue stream, and then you get the added benefit of improved and measurable outcomes. Other organizations are forming joint ventures with the objective of creating synergies and cost sharing opportunities. Some examples of some successful joint ventures include the formation of back office of a number of providers, individual organizations coming together for back office support. We've seen this specifically around billing or an IT infrastructure setup. I've recently heard of 4 providers that formed an arrangement to jointly fund the resources for compliance monitoring and support, rather than turning to a third party in order to help them do that. There are many other examples of joint venture arrangements that are out there right now as far as investing in rehab or therapy services in order to take advantage of those services and extend them to other providers. I've also seen them coming together for staffing solutions and pharmacy, for example, very simple, very obvious examples that are currently in operation today. In any of these examples, there are a number of considerations before you enter into such a decision. Excuse me. This is particularly around due diligence on the potential partners that you might be aligning with and making sure that there is common values and expected outcomes as a result of these arrangements. These are just a few examples in which non-traditional services can play a role to enhance an existing or a new service delivery model. We recommend the development of a strong business plan for the initiation of any of these opportunities to ensure the availability of necessary resources, the ability to achieve the intended results, and to ensure focus is maintained on the organization's core operations. Because we want to make sure that we don't get distracted from the core operations as we're exploring different ancillary relationships. With that, I'd like to open the final polling question before Mike ends our presentation with thoughts on how to respond to consumer preferences. And that question is, what other non-traditional services or programs are you exploring? And we've listed a number there through A through H. And with that, Mike, I'll turn it over to you.
Great, thanks, Jen. So just a couple of minutes on responding to changing consumer preferences. Consumer preferences are probably the most difficult to predict of all the trends we can talk about, because a consumer is an individual. We try to talk about individual preferences in terms of a whole group, which is difficult and often misleading. I remember talking with my grandmother about the silent generation, which is what she was part of, and she laughed at me, and I asked why, and she said, "You can't talk about us that way." We're all individuals. However, having said that, I think I'll talk through a few trends that we think are relevant to consider. Consumers will continue to demand from you opportunities to grow and expand, whether educational, spiritually, socially, or other, both at your community or within the greater community. Thinking through ways that you can provide and expand from your service mix of healthcare, meals, housekeeping, and so forth, to educational, spiritual, and social at the community, as well as bringing those in or taking people out to experience these activities, is critically important to consumers. Challenges with affordability and financial pressures of recent inflationary factors will continue to be a significant issue for new and existing residents alike. Think of it this way: as the pricing increases faster than incomes of seniors, how significantly is your market shrinking? As your prices go up $1,000, $2,000 a month for a assisted living or memory care because of internal or operational factors, how much does that impact your ability to sell in your market? Consumers are very picky about financial issues and affordability as they're looking at options and pricing in the market. And the ability to pay long-term is an issue for them as prices are increasing significantly in the last few years. Bev mentioned this before, and I'll touch on it just a little bit now, that there is this continued expansion of the middle market, and will happen again in 2024, that will be what we consider private pay, but with many limitations. This segment will continue to be the largest percentage of seniors in the US, growing for the foreseeable future. And you will need price points for this segment simply out of necessity to tap into this increasingly larger market. Flexibility and freedom of rental products will be their norm. The segment will not be interested in the entry fee product, at least at our traditional prices. So as that middle market continues to be a larger and larger percentage of the market, you will need to consider how to tap into that, whether it's through pricing schemes, product development, independent living options, or other. Health and safety will continue to be an ongoing demand by consumers. The pandemic created this issue to a great extent, although we always knew health and safety was a factor in our healthcare settings, but the pandemic created a heightened awareness, and now you're left to deal with these higher expectations of consumers going forward. Assuring potential customers that you will have a safe environments that are open to their family in the case of another pandemic, environments that are protecting them from outbreaks, et cetera, is key in 2024 to driving demand into your facilities. If you can do a better job of talking about health and safety precautions that you're taking than your competitors, you might have a bit of an edge. Consumers will continue to expect of you to offer them opportunities of connection to the greater community, in particular the baby boomer generation consumers at your independent living units. Provide designed opportunities to stay involved in the community, work to create opportunities for residents to stay involved, and utilize those messages when you're offering units and services to these seniors, and helping them understand how you will keep them connected to the greater community. And last but not least, high quality, well-designed and delivered dining experience will continue to be a significant selling point for consumers, both new and current consumers in the next year. This again is not a new trend, you all know this. However, it's worth noting that dining consistently rates as one of the most important aspects of living experience at communities, as well as the highest area of highest expectations next to delivery of health services and care. Now, in the last few minutes, I will turn it over to Ed for a wrap up. Ed?
Thanks, Mike. So in wrap up, we appreciate everyone's time today. As you'll see on this screen here, this is our contact information. And if you do have any questions, I'm looking at the chat. I don't see any questions in there right now, but feel free to send some over now if you do have any questions. If some come to mind later, please reach out to us individually if we spoke on that, or any of our contact information here. So we hope that you enjoyed the presentation. We appreciate your time, and hope to see you at some of our upcoming future presentations. So we know it's a challenging operating environment right now. We know that we're hoping that there's light at the end of the tunnel. So there's a lot on management's plate right now. So we continue to hope that you weather that storm, and we look forward to potentially working with you some on the areas of opportunity. So appreciate your time today. Thank you all.